This is a special meeting of the City Council of the City of Cottonwood, Arizona, to be held June 19th, 2020 at 1 p.m. at the Cottonwood Community Clubhouse. Could we please have the clerk take roll?
Councilmember Henry?
Here.
Councilmember Halls?
Here.
Councilmember Howdigi is present via teleconference. Councilmember Nairn?
Here.
Councilmember Wilden?
Here.
Vice Mayor Matthews?
Here.
Mayor Linsky?
Here, thank you. And I want to thank my colleagues here for being able to assemble at such short notice. I appreciate it. And all the folks that are here in attendance, as well as the many hundreds of people who have emailed us in the last literally day and a half. So thanks to you all. Mr. Corbin, did you want to kick things off, or would you like me to?
Mr. Mayor, I'd be happy to get things started. As you know, the governor gave an executive order earlier this week that changed a few things. Two main parts, in my opinion. The first part was new rules for businesses that clearly laid out what used to be recommendations or suggestions, made requirements for local businesses, including restaurants and other places. In addition, the second half of his order talked about wearing masks in public, and he delegated the ability for local municipalities and counties to make their own ordinances and rules as it compares to a mask wearing in public to help prevent the spread of COVID-19. You and I and our city attorney spoke earlier this week, and we thought that before we did anything, many cities have issued proclamations. Their mayors have already issued proclamations. We thought that this would be a better way to do it, to see what the legislative body preferred to do. And so we're here to discuss today on how the city of Cottonwood is going to move forward.
Thank you for that. Yeah, and the reason, again, I've gotten a lot of feedback, as I'm sure the rest of the council has throughout this entire pandemic, about why the city of Cottonwood isn't taking more stringent precautions. And the reason why is because the governor, with the issuance of his executive orders, took away any real local authority to do anything. So we've been trying to do our best just to encourage folks, to maintain CDC guidelines as far as distancing and washing your hands and whatnot. So the reason, really, again, why we're here today is because he has now allowed for municipalities, counties to issue, requirements around mask wearing. So, which I could do by proclamation, but I really value the input that I can receive from my colleagues up here on council, as well as I value the input from the community. So I wanted this to be an opportunity for us to debate this as a council and, of course, receive input from healthcare professionals, the general public, and one another. So, again, thanks to everyone for being here on such short notice. So before we begin, just a few items of housekeeping. Most importantly, the bathroom's down the hall as you're leaving. It's to the right, okay? Secondly, everybody is spaced apart well, and we're going to limit seating in here. There are more folks that are lining up outside. Everyone has an opportunity to speak here today. We're going to allow you some time at the podium. We'll do our best to keep the podium sanitized for you, and we'll allow everyone 3 minutes to speak today. If you would like to speak, there are yellow forms that you can fill out. I believe there are some outside. Many of you already have. There's some inside as well. So if you would like to address the council, you need to fill out a form, and I'll call you up individually and take you in order that I receive these yellow forms. Furthermore, I think I would be naive to say this isn't a much larger debate. It certainly has become a huge national debate, as we've all seen. I would really like to focus this conversation today on Cottonwood and making sure that we come together, as a community to make the best decision we can moving forward to protect our community, protect the businesses that are reopening, and really just try to focus on what we can do here together. Since this pandemic began, when it first showed up here in Cottonwood, we quickly assembled a task force, a community-based task force, with a lot of folks on it from, our police and fire chiefs, medical professionals, business owners, superintendents of public instruction, and we try to figure out what's the best way we can navigate this crisis. It quickly became an economic crisis, as we all know, and so we added a few more business owners. Chamber of Commerce was represented as well, to really focus on how we as a community can recover from this as quickly as possible. And I got to say, I was I've often been humbled serving Cottonwood, but it was just another one of those moments when I realized there's no greater place to live than right here where we are. We all know that in this room, but our community came together in a way that was just very heartwarming. Business owners who had to lay off their employees were helping file paperwork to get them unemployment checks. Many employers continue to pay their employees, put together meals to take home. I mean, you name it. Donations were coming in left and right. Food was distributed to families that needed it. So we really came together as a community. So again, I just want to say there's no greater place to live. I respect everyone's opinion in here. You're all going to be allowed to share your opinion. And we are your representatives up here, and at the end of the day, we're going to be voting on this issue. So what I'd like to do now is I'm going to go ahead and read the information in the communication in our packet so that everybody hears it, and that will help frame the discussion for today, as well as I'm going to read the emergency policy and order as well, which I think will also help frame this discussion today. So we're going to, after I'm done with that, we'll open it up to the public. Again, fill out your forms. You all have an opportunity to come up and address council, and then at the end, council will have a discussion and we'll take a vote. Okay? So here we are. The requested action, this is discussion, consideration, and possible approval of a proposed emergency policy and order requiring the wearing of facial coverings in close public settings with exceptions. The background is Arizona is currently experiencing a significant increase in transmission, infection, illness, hospitalization, and death due to COVID-19. And even though Yavapai County and Cottonwood are not experiencing the kinds of numbers that other parts of the state are experiencing, the behavior of the virus is such that the most effective public health strategies by far are ones that are instituted before a serious outbreak occurs in a community, not afterwards. On June 17th, 2020, Governor Ducey both publicly encouraged everyone who could wear a face covering when they're out in public to do so, and authorized local jurisdictions to adopt policies that make wearing face coverings mandatory. The attached policy would do that for Cottonwood when feasible and with exceptions, and with a strong emphasis on education over enforcement. It is beyond reasonable doubt that an increase in the wearing of face coverings in public settings decreases the rate of spread of COVID-19. Local jurisdictions in Arizona may now decide for themselves whether such a requirement is appropriate for their community, and this is an opportunity for council to have that discussion with or following input from a community that, like many others, is sharply divided over the issue, and make that decision for Cottonwood. And now I'll read the emergency policy and order of the mayor and city council of the city of Cottonwood. Again, this is the one that we'll be voting on later. Whereas Arizona is currently experiencing a significant increase in COVID-19 transmission, infection, and illness, sometimes leading to death, and whereas as of June 17, 2020, 40,924 Arizonans have been diagnosed with COVID-19, and at least 1,239 Arizonans have lost their lives either directly to the disease or to complications arising directly from it. Whereas many of Arizona's hospitals and intensive care units are now at or near capacity, and whereas the trends in Yavapai County and the city of Cottonwood appear to be following the statewide trends noted above, and whereas illness, hospitalization, and death from the complications of COVID-19 are lagging indicators of the spread of COVID-19 in a community, and whereas the wearing of face coverings is known to significantly reduce transmission of COVID-19 in public settings. Whereas by Executive Order 2020-40 issued on June 17th, 2020, Arizona Governor Doug Ducey authorized counties, cities, and towns in Arizona to adopt policies regarding the wearing of face coverings in public for the purpose of mitigating the spread of COVID-19. And whereas Arizona Revised Statutes 26-307A authorizes cities and towns to make, amend, or rescind orders, rules, and regulations necessary for emergency functions, provided that they are not inconsistent with any orders, rules, and regulations promulgated by the governor. Now, therefore, the mayor and city council of the city of Cottonwood, Yavapai County, Arizona, hereby adopt the following emergency policy and order. So here it is. 1, effective immediately and for the primary purpose of protecting the lives and health of the most vulnerable among us, including the elderly and those with serious underlying health conditions, all persons within the city of Cottonwood over the age of 3 shall, except when objectively unfeasible, including but not limited to when contraindicated by an underlying physical or mental disability or health condition, or when dining, drinking in a public establishment, wear face coverings that are designed and worn to cover both the nose and mouth whenever such person is in a close public setting. 2, for the purpose of this policy and order, the term close public setting includes any building, facility, school, business, workplace, public vehicle, or other indoor or outdoor space, event, program, gathering, or activity in or at which a person is or will likely come within less than 6 feet of any other person to whom they are not related or with whom they are not currently sheltering. Violations of this policy and order shall be considered civil violations subject to a maximum penalty of $250 for each violation. However, this policy and order shall be subject to enforcement only as a last resort and only following an effort by a person authorized to enforce this policy and order to educate and promote best practices as outlined by the United States Centers for Disease Control and Prevention and or the Arizona Department of Health Services by any person not in compliance herewith. 4, without limitation, and in addition to the exceptions noted above, this policy and order shall not be interpreted or enforced in any manner that infringes on any person's religious beliefs or their right to engage in religious practice, or on the ability of any first responder to carry out their duties as such. 5, this policy and order shall be effective for 30 days unless terminated, modified, or extended by subsequent superseding action by the mayor, city council, governor, or legislature. So that is the policy that we are considering today for vote. So at this time, I'm going to head and call up folks that are here to comment. We are going to ask that you limit your comments to a 3-minute time period. The other thing is you are addressing the council. We are not having a conversation. If you have questions, we will make a note of those questions and we'll answer them all at once. Okay? So the council will be debating up here at a later time, but we won't be debating with anyone that comes up to speak with us today. So, without further ado, I'm going to call up. Oh, there's somebody who filled this out. Her name is Cindy Lowell. She's not here right now, but she did want to express that she is not in support. Oh, you are? I'm so sorry. Oh, I'm sorry. Yeah, I misread it. Come on up, ma'am. Miss Lowell. Thank you for being here.
Person. I come here today as a human being, a mother, and a concerned citizen of this community for more than 20 years. If someone would have told me 3 months ago that I would be standing in front of my mayor and city councilman asking for you elected officials to uphold my God-given right to breathe fresh air, I would have said they were crazy. Not because I don't care, but because my entire adult life I have believed that politics and politicians were crooked, that my vote doesn't really count, and that our officials are going to do whatever they want to do anyways. Yet here I stand, in contrary to my own beliefs, asking you as my elected officials to please hear my plea. To uphold mine, my children's, and hundreds of other community members our God-given right to breathe fresh air everywhere we go, uninhibited by a mask. I love my country. We live in the greatest country in the world. People climb walls, dig tunnels, hide in trucks and boats to get here so they can get a glimpse of the freedom that we as Americans enjoy every day. But something terrible is happening. I do not recognize my country in the last 3 months. And I fear that we as citizens continue to allow this travesty, this tyranny, that when we wake up 6 months, 2 years from now, we will not have much of a country left. It is my duty and the duty of every American citizen to stand together at any evidence that our freedoms are in jeopardy. And today is that day for me. Our law provides that all citizens are free and equal, that we may not be discriminated against in any business establishment whatsoever based on health, such as breathing, which wearing a mask obstructs. I ask that no business or public space require a rule or regulation that is a medical intervention, such as wearing a mask, which is proven by science to inhibit the function of our respiratory system. and that is an essential function of staying alive. The Department of Public Health has not confirmed any findings on masks or social distancing or asymptomatic transmission. The CDC guidelines are based on assumptions, not science, and have no peer-reviewed studies. In fact, the FDA, OSHA, and the CDC have all admitted that masks do not prevent any virus. To impose this mask mandate upon a healthy population, young and old, would be a travesty of justice. Science has proven that masks inhibit safe levels of oxygen. Therefore, if you mandate this, you are taking your healthy population and making them sick.
Ms. Lowell, your 3 minutes is up.
Okay, I'm almost done. Is it okay if I finish?
Just if you could make a wrap-up statement, that'd be great.
To mandate this is just as terrible as if you were to mandate that a sick person is not allowed access to their life-saving medicine. I understand there are some of you that want to wear masks, and that's fine. You're free to do so. You have that choice. But I'm asking you today to look at the big picture, to realize that no virus, not the flu, not AIDS, not COVID, is ever going away. And as a society, we cannot live in fear nor impose those fears upon others to continue to violate our personal and God-given human rights, especially when there's absolutely no science basis for these mandates.
Ms. Lowell, I'm really sorry. I'm
Okay.
trying to be fair for everyone. Thanks for your comments.
I appreciate it.
Okay. We have, is Mr. Murray in the room? Scott Murray? Okay. I believe Mr. Mitchell is also outside, so I'll set that aside. Rose Sperry? Ms. Sperry?
Hi, my name is Rose Sperry. Thank you very much for taking the time to listen to me, for letting me be here. Let me read something to you first. Article 4, Part 1, Section 1 of the Arizona Constitution, Legislative Authority, Initiative, and Reform. Section 1, the legislative authority of the state shall be vested in the legislature, consisting of a Senate and a House of Representatives. But the people reserve the power to propose laws and amendments to the Constitution and to enact or reject such laws and amendments at the polls. It is the legislature and the people of this state who make the laws, not any other entity. Having said that, state statutes give the governor the authority to declare an emergency to deal with an epidemic. If the governor does so, he can exercise all the police powers the state possesses. However, that grant is limited to the powers vested in the state by the Constitution and the laws of this state. A strict reading of that would be as follows. Anything that state law already allows the government to do, the governor can do unilaterally without going through whatever procedural hoops might otherwise be required. But he cannot create new power or authority through executive order. He cannot govern by decree without limitation. Neither can this body. In public health emergency, there are limits to the governor's authority, even in dealing directly with the disease and even under an implied powers theory. There are limitations to the governor's authority. Because this council swore to support and defend both the constitutions, this applies to you as well. Should you be considering forcing the citizens of this community to wear facial masks, I respectfully ask you to look deeply into that document and show this community where you derive such power. If it is not to be found, I implore you not to go down that dangerous path of subjecting citizens to an unlawful decree. Last but not least, I am an elderly person, older than any of you on this board, on this council. I am part of the generation who overcame tuberculosis, polio, German measles, and so many others. I ask you to let me continue to take care of myself. I've done pretty well. Thank you.
Thank you, Ms. Berry. Next is, so this is from Rose McKinnon. She is the one who is not in attendance. So I'll go ahead and let you know that she is in opposition of a mask policy. And I believe the gentleman came in from outside. Is this Mr. Murray? Welcome. You may not have heard, sir, but we're limiting comment to 3 minutes today.
Okay.
And thanks for being here.
Thank you for allowing me to speak today. I'd like to express my views on wearing facial masks. It's shown on the boxes that these N95 masks come in, that it doesn't stop COVID-19 or any other kind of flu epidemic viruses. It's also been proven that this COVID-19 is less efficacy than the common flu. So I would ask that you don't require people to wear masks. Wearing masks only limits your intake of oxygen, so you end up with hypoxia. There's no reason to sequester healthy people when there are only a few sick people. The numbers are not correct. It's all a facade. And if you follow the money, you'll see that Bill Gates and Dr. Fauci are in bed with each other, and they're making millions of dollars on this COVID-19. They want to bring about all these vaccines so they can vaccinate people. If you look back to the CDC in 2012, the drug manufacturers went to the CDC and said they weren't getting the numbers of people that needed flu vaccines, and they weren't making any money at it. So it's a money thing. It has nothing to do with trying to keep people healthy and safe. And when you look at big box stores like Walmart and Costco and all these other stores that can have people by the hundreds go in there, but you don't allow people to go to church, that is wrong. And there's no reason to keep healthy people off the streets. There's things such as herd immunity, and it's worked for the entirety of the time that man's been on the earth. So what I see is by locking healthy people away in their homes, you're creating an environment where people don't have herd immunity, and when they get out, then you're going to have a self-fulfilling prophecy where people will get sick because they haven't been around people. So I ask that you vote with a clear conscience and follow the oath that you took, just as I took when I was a deputy sheriff, to uphold the Constitution, and that you defend it against enemies, foreign and domestic. And that's what I would ask you to do. Thank you.
Very good. Thank you, Mr. Murray. Oh. Brad Reimer. I hope I got your name right. Did I get your name right?
No, that's okay.
Sorry.
Yeah, it's Brad Raymer. A few things in our society that are gone wrong. But let's look at facts. Numbers don't lie. I'm in a business where if you look at numbers, they will tell you what is going on. Arizona Department of Health, in our state, 1,200 people have died. There's 6,200,000 people. 0.0002% on COVID. That doesn't sound like a pandemic to me. Now, I'm not a retarded person or crazy person or anything. I'm not going to get into politics, but I'm a sensible person. Okay, in our community, Yavapai population, 200,000 people, 7 deaths, guys, okay? 7 deaths. That's 0.00003%. Okay, if there's a tsunami coming or the river's flooding, not everybody packs up their house and leaves, okay? This is not a pandemic. Nobody's dying around us flopping on the floor. You're breaking all of our constitutional rights by passing these laws. Read it, learn it, live it if you're going to be in governed body, or you'll be breaking the law if you pass this. You are breaking the law if you pass this. Look at the state law. Look at Arizona State of Emergency Response Plan and Arizona Pandemic Influence Response Plan. It tells you specifically ethical considerations If you break the law, you will be accountable for the law like the rest of us. If you pass any mandates or anything, you are breaking the law. Not only the constitutional laws of our state, the constitutional laws of our country, but you will also be hurting people. And the gentleman was correct. I'm not going to get into his politics, but there is a CO2 problem and it's called, I can't even pronounce it, but you get carbon dioxide buildup in your body where your metabolic cannot be healthy. And you're going to take healthy people and you will make them sick. You will be making that choice to do that. That is a fact. The numbers will not lie. These numbers do not lie. There is no pandemic. There's nobody around us that are dying here right now, okay? Wake up.
Thank you, sir. Marlon Ontiveros, are you with us in the room? I'll call Kat Lenasser. That's another name I probably got wrong, and I'm sorry.
You did very well. Thank you. I wasn't expecting to speak in front of you today, but as a lone person with a different idea, I thought I should. A lot of facts have been stated here that I actually did a lot of research this morning, such as the CO2 and the masks. It's just all a lot of information out there. And I have found information that contradicts the information that people have been saying here. So it is very difficult to find good information. So I do know I used to work in a hospital. There are doctors that wear masks all the time, surgeons. When you have a loved one in an infectious care unit, you need to gown up and wear masks. It happens all the time. I think if there was a real problem with masks, we might have heard of more medical people having health issues. So I just want to throw that out there that I'm not totally convinced that our health is going to be so compromised. I also don't see realistically where we would have to wear masks all day. There's certainly times when you can breathe fresh air, especially if I think what we're talking about, I had difficulty hearing what you were reading, but I think what we're talking about is if there's not a 6-foot space, is a mask required? And this virus that is new, that we're still learning about, has a potential to spread farther than 6 feet. So I guess I'm thinking, even if we did something for a couple months, just try it to see if we can't lower the numbers. In my research, I have found, and in other countries, they have found that social distancing and masks are helpful. They're not the answer. They help the virus not spread as rapidly. And then maybe we don't have our healthcare system, such as the one down in Phoenix and Tucson, so dramatically impacted. So in my mind, I'm thinking of masks as a way to help our healthcare system. Initially, weeks ago, it was sort of a what happens if someone gets sick here and the hospitals are full? The Facebook news was we'd go down to Phoenix. Well, that's not an option. So I guess, and I know you're not going to answer questions, but I guess if we're not going to go do the mask route, I would like to know, do we have significant contact tracing up here? Can everyone who wants a test get a test? If you run a business or have employees, can they be tested at least twice within 10 days? If we have those in place, I would feel more comfortable, but I'm feeling like there's nothing really in place here. I had an interesting talk with my post person, and she told me she's petrified to do deliveries down here on Main Street in some stores because there's not social distancing, there's not masks. She literally said, I hold my breath, and I walk in. I said, well, you know that's not enough. She said, I know.
Ma'am, I'm sorry, your 3 minutes is up.
Okay, that's fine.
Yeah, appreciate
Thank you
your
very
time.
much.
Thank you. So folks, those of you who have already addressed council, we'd ask that you could free up your seat for others that would like to come in. Did you have something to?
I apologize for walking around during the meeting. Our go-to meeting doesn't seem to be working.
Thank you, sir.
So we're working on resolving that. We are live. People can see us and hear us. So we're hoping to have it fixed by the time council starts their discussion.
Okay.
Remember, go-to was a fourth option. People could write in, people could come in, and then they could do this. So we've got IT working on it. Try again. We've tried to restart go-to-meeting a couple times, but I apologize for looking like I'm not paying attention. I'm just trying to resolve that issue.
That's right. Do we have Dr. Ponticus on standby, phone or otherwise?
If he's using the link, he's not on. That's the problem I'm trying to resolve right now.
Okay. And is there another way that he could communicate with us, or?
Give us a few minutes, sir.
Okay.
Before we begin discussion, hopefully we'll have it resolved.
Okay. Very good. Yeah.
I'm applauding. I don't want any side of the issue to feel like they aren't encouraged to speak.
Okay. All right, folks, we're going to call up, we just have a few more slips here. So we'll call those folks up. And we would appreciate it if you could refrain from applause. It makes it seem more like a concert hall than a public forum. So I would appreciate that very much. All right, Mr. Ontiveros, are you with us? Marlon Ontiveros, are you with us? Oh, great. Welcome. So you may not have heard if you were outside, but we're limiting folks to 3 minutes. Are you here to speak? Are you Mr. Ontiveros?
Yeah.
Okay, great. You can take the podium and address council.
Okay. Thank you guys for having this meeting, man. You know, we're in a time of hurt right now. I'm just wondering, I live here in Old Town. Family's been here over 100 years, same spot, same street. Going through the valley last week and the week before that, just seeing the mad amount of people coming through and everything. In Jerome, close to each other. From Jerome, they come down here, probably go to Sedona, probably back around to all the vineyards in Oak Creek. Why are we allowing this? When we knew the East Coast was getting it over there, it was coming this way, and now we're hit hard with it now. What's the plan on this?
Thank you for being here to address council. So you weren't here when we opened it up, but we're just taking 3-minute comments from folks. We'll take questions if you have specific questions, but we won't be having a conversation with you from the podium.
Yeah.
Yep.
Okay.
Anything else that you wanted to say?
No, I just wanted to say, you know, I think what's best for everything is to be shut down, man. You know, just that all this going around, letting people come and go is hurting the economy more than helping it, I think. Okay. That's all I wanted to say.
Okay, thank you, sir. Mr. Mitchell, are you in the room today? Welcome.
Good afternoon. I understand the limit is 3 minutes, but I have a lot of information that I'd like to share with you all that's scientific and factual regarding mask wearing or continual mask wearing. And I know that's what this situation is about. And just so that I don't have to just read it and bore you with it, I'd like to be able to send this to you, if that'd be all right, because I'd like to have you examine the facts of the effects, long-term effects, if you choose as a council to go with requiring face masks, which I'm on record as being against, by the way. Not only is it unconstitutional for my rights, but I think it's actually unhealthy. So I'm going to give the balance of my time, if you can permit me to give this material to you for consideration. Okay?
You can hand it over here and we'll...
Okay.
Yeah, you can distribute it that way. It's fine.
All right. Thank you for your time.
Thank you. Folks, again, we have yellow forms. They look like this if you'd like to address council. I see there's many in the room that have not yet addressed council. You're more than welcome to. Sandra, are there any others outside yet? Sandra, are there any others outside that would like to come in? No? Okay. Okay, then last up we have our chamber director, Christian Del Rio, and you put together a survey that you sent out to all your businesses. So if you could just take your time, Christian, and give us the information, that would be helpful.
Yeah, thank you, Mr. Mayor and council. I did already email you all the results of this survey, along with the comments as well. We've got around 642 that were sent out and roughly a 35% open rate, so I'm kind of happy about that. I think a couple of the issues that some of our businesses need to really realize is that the governor's order has already put requirements on all of our businesses. The issue at hand is really general public, I believe. And if you go to question 3, I did provide you all with copies of that here. Question 3 kind of does address that, and you would see that it's pretty much a 50-50 split, just kind of expecting. I was able to communicate with a lot of the neutrals in that, and the overwhelming majority of them felt that if mask wearing was going to help contain and help businesses kind of try to get back to normal, they were willing to do it. So that's the sentiment I'm hearing. There's strong arguments on both sides of it, and I'm here to tell you that I appreciate you guys taking this challenge on, and I don't envy you, but I do appreciate the work that you're doing in making this decision. So again, I did make this available to you all via email. If you've got questions, I'm available. You know how to get a hold of me. And I think I will defer the rest of my time here to anybody else that wants to speak, unless you have specific questions.
Okay. Did you want to just take a second and just go through the numbers for the public and those
Absolutely,
listening?
we can do that. So question 1 was, all businesses in Cottonwood that deal with the public should remain or require employees to wear masks. Strongly agree was 46%. Somewhat agree was 13%. Neutral was 9%. Disagree was 5%, and strongly disagree was 28%. Question 2 was, all businesses in Cottonwood that deal with the public should require employees to wear masks only when social distancing is not possible. Strongly agreed was 18%. Somewhat agree was 16%. Neutral, 14%. Disagree, 15%. And strongly disagree was 37%. Again, question 3 was, all persons in Cottonwood should be required to wear masks when venturing outside their homes, hotels, RVs, or other residences when social distancing is not possible. 37% strongly agree, 10% somewhat agree, 6% neutral, somewhat disagree is a 6%, and strongly disagree was 41%. We did also ask a couple other questions regarding if any businesses should be exempt. There was a strong consensus that people working outside, construction, these kind of things, trades, should not be required. They're limited exposure with the rest of the public. Definitely felt that restaurants and bars should implement some kind of face covering. Some of the greatest single COVID-related concerns that businesses might have now reflected on overwhelming our hospitals, PPE supplies. On the other side of that, a lot of people concerned about losing businesses or losing customers. If it's required for people to come in, they may choose not to come in. So pretty strong consensus there. We also asked about rating the following concerns, with 1 being the most concerned, 5 being least concerned. And in order, health and safety obviously was number 1. Getting businesses back to normal at 12%. Getting people back to work was at 13%. Second or full partial business shutdown came in 4th. And continuing information about funding opportunities came in last, surprisingly. So We also asked about supply chain. It's interesting to me that 41% of our businesses polled do have a concern about supply chain shortages. 54% did not or didn't have an opinion. So that's our general information there. We can make this available to anybody that's interested. It will be posted on our website. If you have any other questions. Again, I didn't really want to go into a lot of the comments. There's quite a few of them. And again, they range from both sides.
Very good. Well, I appreciate you getting that out to your chamber members quickly. Thank you very much for that. Yeah.
Thank you.
I'm a member of the public. May I speak?
Yes. Hello. Good afternoon. So you have you'll have 3 minutes to speak.
Okay. All right. Thank you. I appreciate it. So I kind of prepared a speech that illustrates my feelings on this matter. Some say that masks don't work and that the science is untrue. I say, what do you have to lose? Some say this infringes their personal liberties. I say it's not personal when you're potentially putting others in danger. No one's complaining about this municipality is complaining about the public indecency laws and that later. Nobody complains about DUI laws. You may not kill someone, but DUI laws, you may not kill someone, but the danger is significant. Some say that the virus is a hoax. I say speak to all the nurses and ICUs all over the world. Some say that those who feel at risk should stay inside. I ask how. Fellow man or not fear. Some cite the fact that the illness is mild in most people. I'd like to point out that the definition of mild in healthcare includes all patients who aren't able to recover without hospitalizations. Some say that masks become soiled quickly. I say bring more than one. Chances are you know multiple people with asthma, hypertension, and other conditions. They need your help right now. Flattening the curve is not about stopping the virus. The virus is inevitable, as we all know. It's about slowing the virus, prevent the oversaturation of health systems, and improve health outcomes. With freedom comes responsibility. Masks don't protect the wearer, they protect the people in the vicinity of the wearer. This requires universal compliance. Since too many people are not taking personal responsibility to flatten the curve, I believe that masks must be mandated in this municipality. I will not be participating in the local economy for any businesses that are not observing social distancing. Thank you.
Thank you, Ms. Patterson. I don't know how to call up the next people that are on Zoom, so this is kind of new to me. Is there
Matt, excuse me, Mr. Mayor.
Yeah.
Matt, is there a way to select one person at a time to see if they'd like to speak? There is a function on there to raise your hand if they wanted to be recognized normally. So if a person online would like to speak, if they raise their hand, Matt could individually recognize them when you're ready, Mr. Mayor.
Okay, that's great. So to the folks that are on Zoom, or whatever this is, if you could raise your hand virtually, then Matt, our deputy clerk, will see it. And Matt, if you could cue them up for us and just have them address us. And again, folks, you'll have 3 minutes. Modern world.
See it, and if you can cue them up for us and just have them address us. microphone. Oh, well, I guess I'll turn it off. Oh, well, I guess I'll turn it off. I got reception. It doesn't sound like I got reception. Well, this says it's too far away from the Well, this says it's too far away from the speaker.
Do you have some names, Matt? I could... The what? Is Cheek, Janine, I believe, Cheek, are you on the call? And go ahead and unmute, and you have 3 minutes. I think I'm reading the name right. I need glasses, apparently. Janine, I believe you're live, I think, and you can go ahead and address us. Ron, should I move on to Dr. Ponticus?
If he's on the line, yes. Dr.
Ponticus, are you on the line with us today? And if you are, can you go ahead and unmute? Dr. Ponticus, are you on the line? Would you like to address the council? All right, Shelley Haken, are you with us? Go ahead and unmute, and you're free to address us. You have 3 minutes.
Yes, I am here for recognizing me. My husband and I moved to Cottonwood from New York City, the New York City metro area about 4 years ago. And as such, we have many friends and family who have suffered from the horrors of COVID-19, and we know several people who have died from this disease. New York City took drastic measures to slow the spread and flatten the curve, and they have significantly decreased their rate of infection and are in the process of safely opening up. My friends there tell me that no one goes outside of their house without wearing a face covering, and no one there considers it a hardship to do so. Here in Arizona, we're on a steep upward curve. Today, the Arizona Health Department reported 46,689 total cases, which was an increase of 3,246 cases just overnight. That was the highest daily increase so far. Over 1,300 people have died in Arizona, and there were 41 more. Yavapai increasing rapidly, as is Cottonwood. I was a math major in college. I track these numbers daily, and I have graphs, and the graphs are horrifying. And I know you know all these numbers, and I'm just hoping that the city council decides to require face coverings in enclosed settings and outdoor locations where social distancing cannot be achieved. Nobody says that their rights are being taken away from them when they're told they have to wear a seatbelt. I see this as being the same thing. The health and safety of me, my family, and my friends and my neighbors depend on it. Thank you.
Is there anyone else who has their hand up, Matt? For everyone who's called in, if you can raise your hand to let our deputy clerk know that you would like to address the council. We'll go ahead and call your name and unmute you, or you can unmute yourself, and you can address council. While we wait, Dr. Ponticus, have you been able to log back in, and are you with us now? Dr. Ponticus, are you on the call at this moment? I hear somebody. Well, we're obviously having some difficulties with our technology here. First time we've tried this, so, we gave it our best. What should we do, Matt? Are we just moving on from this platform? Dr. Ponticus, if you've just arrived, if you can address council. We can hear you now. Hey, we're having technical difficulties too. I'm glad we connected.
I'm glad. I appreciate the opportunity to participate here. I was in for a few minutes and able to listen to a lot of the speakers and presentations, and obviously realize that there's a lot of different opinions, different perspectives on this issue. I'd like to speak to this today specifically from the medical perspective, and I'm not sure if it's been distributed or not, but I know you received a letter from the medical staff at Verde Valley Medical Center giving our consensus medical opinion on this, and I realize there's other perspectives besides the medical opinion, but I guess I'll be brief here, give the most people the chance to speak. When we look at a medical issue, which this is, I agree there's constitutional issues and business issues, etc. But when we get right down to this, the heart of this is a medical issue. And speaking as a physician, when we're dealing with a patient with a disease, it's our obligation to discuss with the patient the underlying condition, the options for treatment or management, and the risks and benefits potentially of various options. And I think the same sort of situation applies here. And in situations such as this that are uncharted territory for our community and our society in general, we don't know everything there is to know about COVID, but we know a lot of things about it. When there's such a situation, it's our obligation to assess the situation and decide on safe options. When there isn't a lot of data to go on, we are sometimes left swimming in the dark. When that happens, the general principles within medicine are if we are to err in any direction, to err on the side of caution, as long as going in that direction doesn't cause any harm. There can be arguments made, the things we're talking about as far as the constitutional issues and the business issues, etc. But when we talk about harm, I think we need to talk about it as far as physical harm, danger with respect to infection, illness, hospital admission, and death. And if we boil this issue down to that, the issue of wearing a mask can be a nuisance. It can be poorly accepted by some people, but the bottom line is there is a lot of evidence around the world and a lot of good studies that on and above social distancing, it does further reduce transmission from person to person of COVID, and there is little to no harm in wearing a mask as long as we eliminate certain people in the population that potentially could be harmed, and that's a very, very, very small percentage of people that can find wearing the mask dangerous to them. So the preponderance of the medical opinion would be that from a medical perspective, this is a no-brainer. You would not find a healthcare provider in a hospital going in to see a patient without a mask. When we had a shortage of PPE, the biggest concern of every nurse, every doctor in the hospital was treating patients while not wearing a mask. If those people are understanding the importance of a mask and understanding the added safety that it provides them and their families by wearing a mask, I think it's quite obvious then that where the medical opinion lies on this. We don't expect the nurse to go into a room and look after a patient with the nurse not wearing a mask. And I think that same thing applies to society. My last point I'd like to make is that if we talk about business repercussions as far as wearing a mask, but I think we have to look at the alternatives. If we don't act cautiously and this pandemic gets away from us again with a second wave, our alternative is looking at things that we have already had to do, the drastic measures of shelter at home and the like, and the drastic measures of business restrictions. And those sorts of things are things that we would love to, of course, avoid again. And if wearing masks allows our society and our economy to proceed relatively untouched, I think that's just an added reason to proceed with this. When this is all done, we want to come down on the right side of history, and I think the choice will be to come down on the safe side of wearing masks. That's all I have.
You sent the information to me. We forwarded it to council, but you had cited some studies of some empirical data in different parts of the world that did show that the masks were effective at slowing the spread of the virus. Can you go into just a little bit of detail about that? Because we've heard a lot today to the contrary from folks that have presented to council.
Most of the data that that is out there is data comparing various counties in other countries. There's studies from Britain, from Germany, etc., where certain counties put in mandatory mask policies, and there's a lot of evidence that it shows within days of putting in mandatory mask policies in those counties, the rates of infection dropped dramatically. 2 or 3% per day for the first few days, and then picking up after that. And the counties that had mask policies very rapidly within the first week or so showed dramatic lower rates of infection than the surrounding counties. I think, most of the studies, they're all a little bit different, but they all sort of show that same pattern, that little pockets of areas that put in masking requirements very quickly showed drops in the infection rate. And especially in our situation in the Cottonwood, Red Rocks of Sedona area, where we have a lot of tourists coming into the area, we can't always eliminate the virus locally and stay cloistered or cocooned that way. But the same sort of things would apply if people coming into our areas are forced to wear masks. We can protect our local community.
Thank you, sir. And now that you've finished talking, would you like to introduce yourself and who you are?
I'm sorry, should have done that at the beginning. My name is Dr. Leon Ponticus. I'm the Chief Medical Officer for the Verde Valley Medical Center and Northern Arizona Healthcare. Live in the community of Cottonwood and have for 7 years. And as I said, this is not just my personal opinions, but it's medical opinions, and it's the concerted opinion of all of the leadership of the medical staff locally within the community at Verde Valley Medical Center.
I hope you'll stick around if we have any other questions from council. Okay. Matt, do we have anyone else whose hand is raised and would like to speak? So whoever wants to speak will need to send Matt McLean a chat message and let him know that you would like to speak, and we'll give you an opportunity to speak. And is there anyone currently? If there's anyone who would like to speak, go ahead and unmute. Okay. I think that's... yes, sir. Is this Mr. Burdett?
what do you call it? Those studies, I've looked at those studies myself, and I noticed that they were mostly based on comparing country to country rather than a experimentation on the masks themselves. And everywhere I've looked, I haven't been able to find something that definitively proves that the masks significantly help with the viruses. But I mean, besides that, there's, Dr. Birx recently coming out saying that she thinks up to 25% of the numbers, I think cases or deaths or both, are inflated because they were not tested. Nobody was tested. And then you put that together with COVID. A COVID death death from COVID and then with COVID, because you can have it and still have cancer, terminal cancer. So I think those should be separated, but they're not, and they're counted together as being the same thing. Besides that, I like to go to the side of a more neutral platform or stance of individual risk assessment, that people should be allowed to choose for themselves what they want to do. Like they can wear masks, gloves, they can go further than that with visors if they want. But I don't believe that this should be forced upon others. And that the founding principle of this country was based on and I think if the new standard is safety, pretty much anything can be justified for your safety. And so the neutral ground should be pretty much, in summary, individuals making their own risk assessments. And if they feel like they are susceptible to illness or disease, that they should take those precautions. And I urge them to do so, but it shouldn't be forced upon others.
Sir, Mr. Burdette, you're okay, thank you. Your 3 minutes is up. Thanks for calling in, I appreciate it.
All right, thank you.
Matt? Okay. At this point, then we'll close the floor to the public and open this up to council. And I hope that Dr. Ponticus is staying on to answer any questions in case we have any. Yeah, let's have a conversation.
Yeah, I'll be staying on.
Thank you, sir. Yes, ma'am.
I'm back. Do I want to keep, I wrote this down so I don't miss anything and it was clear for me. Do I want to keep Cottonwood residents, business owners, city employees, and visitors safe and require all possible to wear a face mask? A resounding yes. Duties of the council, as it says on the city's website. The council makes policy decisions and is empowered to enact ordinances and policies to protect citizens' rights. I personally will not frequent those businesses or areas with crowds that don't respect others' space and wear masks. Some Americans believe mask requirements are against their constitutional rights. People have a sense of entitlement that makes them think they have the right to do whatever they want in the country. But that's not true. You can go to some restaurants without shoes. You cannot go to some restaurants without shoes. You can't go to restaurants without a shirt on. So this is kind of the same thing. So what can we do as a city council? Some believe it is not a good idea or healthy to wear a mask. What if we are given the authority by the governor to require people not to wear a mask because it has been deemed unsafe? I believe one option is to encourage no shirt, no shoes, no mask, no service option, and authorize businesses to refuse service to maskless customers. I personally will not frequent those businesses or areas with crowds that don't require masks. That is my choice and the freedom to make that choice. Does wearing a mask prevent you from getting or spreading the virus, which continues to be disputed? Some say yes, some say no. I believe we should err on the side of caution, as mentioned earlier, and that's the correct, if that's the correct phrase, and require face mask wherever possible. If it's good enough for Dr. Fauci, the director of the National Institute of Allergy and Infectious Disease, it's good enough for me. Requiring face mask in public is a widespread belief that doing so slows the spread of the virus. Respectfully, Debbie Wilden, Cottonwood City Council. Let me also mention, as some may or may not know on the council, I was in the hospital for 5 days. I just got out yesterday. And it wasn't COVID, by the way. I had 3 different doctors. Every one of them came into my room and warned me about Cottonwood has been hit with COVID. And begged me almost to please be safe and keep myself safe and others safe. So an example of one of the 3 doctors, everyone had masks on, everyone, no question, and I did as well. One doctor came in and had 3 masks on. She had what I will call a COVID type mask. Over that she had one of these type masks. Over that she had a face shield. So that's my belief, and I wanted to pass that on.
Thank you. Ms. Henry?
Are we going around in order?
Yeah, we can jump over here if you prefer.
So this is a tough one. I think we heard a couple of comments earlier that said, you know, we've looked online and there's information on both sides, and I've spent a lot of time online. I also asked, as many of you know, for community input on my Facebook page, and the community responded in large numbers, and I do want to just thank folks for taking time out of your busy day to reach out, not just to me, but also to my fellow city council members, our city manager, and our city clerk. I have read, even though I haven't had a chance to respond to all of the comments, but I do thank you for reaching out. I respect everybody's opinion. The majority of the communications that I received from constituents, I also received a large number of comments from folks that do not reside in city limits. The majority of my constituents were in favor of the city encouraging folks to wear masks, but not requiring folks to wear masks. They were also in support of the city encouraging businesses to require, wherever possible, that if they wished to have folks to wear masks. Again, the majority of my constituents told me that every citizen's health is a top priority, but even more importantly is the right of each citizen to make an independent decision based on what is best for them and their family. So as an elected representative today, I cannot support a city mandate requiring a mask. I wholeheartedly encourage folks to wear a mask if they believe that it is helpful. I have to say today, I have a concern because Dr. Ponticus's comments are very well taken. I think that masks, medical masks, when worn appropriately, when they're put on and removed appropriately, can be a very powerful tool to stop the spread of disease. I can also honestly tell you that my mask that I picked up, box of 25 from Walmart, and the way I put them on, take them off, I was at court today. I was forced to have my temperature taken. I have no problem with that. Forced to wear a mask. I have no problem with that. I'm happy to comply. But I also noticed that I'm touching doors. I'm tugging on my mask so I can talk through it and have a clear record on the microphone. I'm sharing exhibits with witnesses. I'm touching tables. I'm touching pens. I'm touching all sorts of surfaces. I'm touching my mask, taking it off, putting it right back on. I don't believe that I am an effective mask wearer and that wearing this mask helps stop the spread of disease. Now, I'm trying to be better, trying to remember to carry more masks, et cetera, but I have concerns about saying, let's mandate mask wearing when we're not saying, folks, do other things as well. Wash your hands, take your staff temperature. It's some of the things that the governor has now passed. Many of the comments that I received were from folks that are also medical professionals that did not speak today, that were surprisingly not in favor of general usage of masks in the general population. Leadership from some of our schools did say, how do we work around a city implementation of masks in our schools? I have different business owners also, expressing concerns, and workers, mothers, fathers. I think it was a good representation of our community, and that's really the sum of my comment. I apologize for being disorganized. It has been a lot of information to process in a very short time frame. Thank you.
Thank you. Mr. Hulse, would you like to comment?
This is a difficult situation for the council to be in, trying to make a determination about whether or not to require citizens of Cottonwood or visitors of Cottonwood to wear masks when they're in public. I have to agree with both council members Henry and Weldon. It's a difficult position to be put in. There are pros and cons to wearing the mask. The masks are not designed to protect you from other people, but protect other people from you, as I understand the purpose of the mask. So then I reach back in my mind and I think about my training and my understanding of the Constitution and enforcing the laws as a police officer. Your right to swing your fist ends where my nose begins. And that brings me back to the question. If I'm wearing the mask, I'm not going to be infecting somebody else as quickly as if I'm not wearing the mask. So am I violating your rights or not? And that's a question that needs to be looked at. On the other side of the coin, and I understand Chief Gazelle is here, and I understand his position, the police department, with the ordinance that we've proposed, puts a strain not only on the officers to enforce the ordinance, but also in the situation that we're in this country right now with the division of people. I'm not sure that it's a wise thing to try to apply something that, as we've heard this afternoon, many people feel is a violation of their constitutional rights. I'm not sure I'd agree with that. I think it's, if it can be shown that it is a purpose to reduce infections, then it's probably a good thing to do. It's a temporary imposition. On the other hand, do we have the right to make that decision ourselves? I think possibly we do. So I'm in a quandary. I'm really up in the air in both directions, and I'm looking for advice from the rest of the council. But I feel like, yes, the mask does prevent virus, but I'm curious why three states, Arizona, Texas, and Florida, all of a sudden have big spikes. And then I think about Minnesota, New York, Illinois, California, Washington, where we've had these large riots, large protests. We're not hearing any big spikes in coronavirus in those states. And the question runs through my mind when I see several hundred to thousands of people gathered together in the streets without masks, and we're not seeing big spikes in those cities. Is our spike due to the fact that we're doing more testing than we had been doing before, or is in fact there is a larger problem going on right now in Arizona? And I don't have that answer. So
thank you, sir. Mr. Hodegui, you're not with us in person, but I believe you're on the phone. Would you like to share any comments with council? Yes, sir. Thank you. Councilmember Nairn.
So this is really a tough decision, I agree. And normally I vote with what I hear from the public is the majority opinion. However, the public is very much divided on this, and there is no majority opinion from the public. At my place of employment, I'm forced to wear a mask to remain employed. And I just want to put this personal story out there. For all those people with lung conditions and that have trouble wearing masks, and all the information out on the internet that says, no, nobody has trouble wearing masks, but I do, my boss does, and my coworker does, all because we have lung issues. And when I put that mask on and walk around the corridors of my building, within 5 minutes, I'm having an asthma reaction. Within 7 minutes, I'm dizzy. And since I'm going up and down the stairs trying to avoid the high traffic area of the elevators, it's definitely putting me at risk, which also could put others at risk if I were to, pass out and fall down the stairs and who knows what. I have not been wearing a mask in public largely because it's not safe for me to do so. and there's many other people out there in that situation. So I do see a lot of people wearing masks in public and a lot of people not wearing masks in public. I'm hearing from people that if we pass this as a law for our citizens, how are we going to enforce it? And especially enforce it for the visitors and the tourists that come here that may or may not know that we've passed this law. I do think it would put a big strain on our police department to try to enforce yet another law, and one that there will be very many people who will not, for one reason or another, wear a mask. So, one of my questions is, if I'm not going to wear a mask because it's not safe for me to do so, how many times am I going to be stopped by police trying to force me to wear a mask? And how is that going to play out? And maybe I won't now because I'm up here and everybody's hearing me say this, but how many other people in this situation are going to be asked that question by officers? My other concern is with the amount of phone calls that people are going to make to the city to report violations. I am seeing it at my place of employment, where my residents are quite divided on this issue as well, and those who feel that other people should be social distancing and wearing masks are calling everybody that they possibly can, and emailing everybody that they possibly can, trying to make people abide by these recommendations, which it is nearly impossible to do. So, as divided as everything is, I would err on the side of not mandating masks for the reasons I've stated, but strongly recommending for those who can wear masks to do so in our messaging. Thank you.
Thank you. Vice Mayor.
Okay, bear with me, I may jump around a lot. But since the founding of our country and the formation of its government up until today, many people have risked and others have given their lives for the liberties and freedoms that we have today, and I do not take that lightly. Again, I don't take lightly people's health and the fact that people die. It's not good. I don't think anybody here would think that anybody getting sick or anybody dying is a good thing. It's a horrible thing, but it happens, and it happens all the time, and it's going to happen to every one of us. And just to put some things in perspective, this really is about health and about people dying. If you think of it, did you know that 3,700 people around the world every day die in traffic accidents? It's 1.35 million people every year. I dare say we could prevent all of those deaths. We just have to mandate a worldwide traffic speed limit of 25 miles an hour. We don't do that. Those lives are valuable. I say if you got those 3,700 people in here that died every day and looked at their faces, you would agree they're valuable, and we should consider their lives. But yet we don't ask everybody to drive 25 miles an hour, and why is that? We won't say it directly, but it's because we enjoy our liberties and freedoms. We want to get from point A to point B in a certain amount of time, and we consider that cost. When y'all got in your automobiles and came down here, you took a risk. You had to consider the cost. You could have died. People do every day in their automobiles going from point A to point B. Or maybe you didn't die, but you could have taken somebody else's life in doing so. Also, too, just another perspective, something I think about, is we're talking about things going down the line 50-50, which this kind of lays down the line 50-50. 50% of the people in this country would tell you, keep your laws off my body. And they're very adamant about that. They want to make their own choice. And I might say that almost 100% of the time, that choice results in the death of another person. I don't think wearing a mask or not wearing a mask is as dangerous as that choice. I don't think you can correlate that. Also, too, if you think about medical professionals, I see they're very passionate about this. So are soldiers that have been in battle and seen and experienced the horrors of war, and they'll come back and they'll be against war. It's horrible. But I don't think anybody would say we shouldn't go to war at times and that it's not justified. I understand those people are in the trenches and they're seeing this every day and they're very passionate about it. As far as science goes, what passes for science today isn't really necessarily science, and there's enough of that on both sides. And there's a ditch on both sides of this road, to which they can go off either side. Wearing a face mask is a very personal, since it involves infringing on one's personal body space. And the only mandate I see where we mandate, or other people mandate by law what somebody wears, is Sharia law. And I don't think anybody suggests we do that. Also, on average, 36,000 people die every year from the flu. We haven't worn masks before this. And if we mandate masks for COVID-19 because of people's health, and some people may die, and maybe it helps, maybe it doesn't, then I think we need to continue that, because those thousands of people that die from the flu every year, I think their lives are just as valuable as those who die and risk dying from COVID-19. Or is it just a number? Is there some arbitrary number of how many deaths happen before we care? Is it 5,000, and then the 5,001st death is the one we're going to be concerned about, and we're going to make everybody wear masks? But if you take it to its logical conclusion, we should just continue to wear masks indefinitely, because if it helps, then it's going to prevent those deaths that are coming in the future. From the flu, somebody catches a cold, they get pneumonia, and they die. It's horrible. I don't wish that on anybody. Yavapai County, as well as many other districts, have stated, and I will state the same thing. This body should suggest and recommend people wear a mask. If that's what you want to do, go ahead and do it. They have decided not to mandate it by law. I'm going to quote Galveston County Judge Mark Henry, and that's just a coincidence. Purely coincidence. And this is a decision he made here recently. America was built upon the fabric of individual liberty and freedom, wrote Henry. It's important more now than ever that we stress personal responsibility. Covering your face while in public is being recommended by national and local health authorities. While we encourage that you consider these recommendations for your own safety and the safety of others around you, I will not be mandating it because I believe it is unconstitutional to do so. Personally, I also believe it to be unconstitutional, and it violates individual liberties and freedom. And it's a horrible precedent to set regarding that. So that's what I have to say on it. I also strongly support any business that wants to mandate their employees to wear a mask or anything else. I support those businesses to ask people to wear a mask or not come into their business. They have that liberty and that right to do so. And I want to preserve everybody else's right to liberty and to decide whether they're going to wear a mask or not wear a mask, or go into a business or not go into a business. So I think I'm pretty clear on where I'm at. Thank you.
Okay, thank you very much. So, Council, like you all said, this is obviously a difficult decision, and I think the first woman that got up to speak, said what a lot of us, I'm sure, are feeling, that she said 3 months ago, but let's just take it back to, the earlier part of the year. None of us could have imagined that we would be in this room together having to make a decision of this magnitude and weight. And the reason why none of us can imagine it is because really none of us in this room have lived through a global pandemic. We haven't, so we don't really have any frame of reference. So I certainly could not have imagined that I would have to be here making a decision that would be impactful in a way that this is to folks' lifestyle. Couple that with a lot of other terrible things that are happening in the nation. Everyone is just a little edgy, myself included. We've got a fire burning in Arizona that's like bigger than Mesa right now in a part of the state that I absolutely adore. So, there's just a lot of bad things going on right now, and it's just sort of further makes us a little, just edgy. I was, in the beginning when the coronavirus was, Washington State was a hot spot, we were watching it. I remember being with Ron and saying, I don't want to panic, I don't want to react, I want to respond. We're going to wait for the numbers to come in, we're going to see what happens. I was very adamant about keeping businesses open for as long as possible, because I could foresee the devastating effects that this would surely have on our business owners. And so we held the line for as long as we possibly could. I had a very sobering conversation with Dr. Ponticus, whom I'd met a time or two before. Again, he's our chief medical officer. He called Ron and I. We were sitting in Ron's office. He had the mayor of Sedona on the line as well. And he just laid it out for me that we don't have enough hospital beds in Cottonwood to handle a surge of any significance. Average is, I believe, and he correct me if I'm wrong, but average is 1 bed per 1,000 across the nation. Cottonwood has 1 per 2,000. I think he said they would max out at about 70 beds is all they had. And that's pushing the envelope, pushing the limits of their capacity. So he said, it's really important that we curve we flatten the curve. And so I thought about it. I was still holding the line, went back. I called him back. I called many other practitioners in the area, people I trust, and did some research. And I realized, this will overwhelm our hospital if we don't do something about this. And we will find ourselves in a position of having to make some really terrible decisions that we have since seen other communities have to make and other healthcare practitioners have to make, which is who lives and who dies. And those aren't decisions that I really want to live through if there's any reasonable way that we can prevent that. And it turns out there are many reasonable ways that we can prevent that. Washing hands, maintaining social distancing, wearing a mask when you can't be socially or physically distant from somebody. There are many, many things that we can do. And, the governor has recommended that we do those things. Consequently, the governor has opened up our economy. Well, we can't have it both ways. The opening of the economy signaled to the vast majority of people, coupled with our relatively low numbers in the state, that everything was okay, whereas everything is not okay. I mean, we see a spike occurring right now. Numbers are rising. And I get that it's not yet an alarming number of infections, and certainly there are many things that kill people every day that are just as terrible as this. But this is something new. This is a virus that we're not yet very familiar with. It's only been around since December. It is highly contagious, and it can live within a body for several weeks before you have any symptoms, if you show any symptoms. So as much as I really hate the word mandate, and I really hate, if you put government in front of that, government mandate, I can't stand that. I get it from my mom, right? You don't tell us what we can't do. It makes the hair on the back of my neck stand up. It really does. So for those in the audience or who are with us today that feel that way, I'm right there with you. There's a few words lately in the last few months that I've learned to hate even more than government mandate. That would be asymptomatic transmission. I don't like that word at all. I don't like the fact that this can live within my child, and she'll never show any signs of it at all, but she can certainly transmit it to dozens of people who can then transmit it further on. This worries me a lot. Novel is another word I don't like. Novel coronavirus. This is new. We know it's sweeping the the globe. We know that there's going to be a second wave. We are a ways out from any kind of a vaccination that can help, stop the spread of this virus, or any kind of a cure that can help, mitigate the symptoms of this. So as much as I don't like, government mandates, I don't think it's really worked for government to say we recommend, or even we strongly recommend. We've seen that hasn't worked. If you go out on the streets right now, you will see that most people are not following that recommendation, even that strong recommendation. So it really is sometimes up to government to set the example and be the model for best practices. And I do understand the argument too about personal rights, even constitutional rights. I disagree that a government asking you to put a mask on, or requiring you to put a mask on, is a violation of your constitutional right. There have been many times in our nation's history when we have been asked to do things for the betterment of the entire nation, sometimes for the betterment of the entire world. And in recent history, World War II, everybody sacrificed in this nation to do things to help the greater cause, right? Wearing a mask for an hour or so a day when you go into a place where you cannot physical distance for a period of 30 days to help slow the infection rate of a virus that we don't have a cure for yet, of a virus which will directly impact 27 or 28% of our population who's most at risk, 65 and older here in Cottonwood, 27 or 8%. 20% of us live in poverty. Those who live in poverty are also more susceptible, the numbers are showing. So again, just a couple hours a day max. Put on a mask. We're not talking about put on a mask when you walk your dog. There are exceptions in this policy for if you have health conditions that would impair your ability to wear a mask. So we're not going to be heavy-handed on this. I don't see our cops handing out tickets. I see the government just setting the example for best practices as a way to indicate to the population here that we're not out of the woods yet. We care about our elderly, the vulnerable, and we're gonna do this for 30 days to limit that spread so that we do not overwhelm our healthcare facilities, we do not put our first responders at risk, and that we can keep our businesses open. We just can't have it both ways. We can't keep the measures the same as they always have been and open the doors for business. It's just not going to work that way. And I don't want to be at the tail end of this realizing that it hasn't worked. I would much rather be at the tail end of requiring masks and showing that has made an impact. That's the side I'd prefer to be on. So it's no secret that I am in favor of mandating masks, though it is a difficult decision for me to have to make. And in closing, I'll just say, and again, bringing it home for me. My father-in-law fell last fall and injured himself and had to go in for physical rehabilitation. Okay. Well, he hasn't left because the pandemic came, and so he's been on lockdown for this entire time. And so for him to visit with his wife, she has to go to the facility, rap on the window, and then try to get him to figure out how to use his cell phone so that they can talk through the window. Her husband of 60-some years, he and she are my daughter's last chance for having some sort of a grandparent in their life. And if I can make a small sacrifice to help them know their grandparents and know a little bit more about where they came from, if I just have to make a tiny sacrifice of being inconvenienced by a mask and washing my hands and doing the other things that will help, I'm all for it. I'm all for it. And I hope that Cottonwood will join me in that effort because I do believe we can make a difference and limit the spread and get back to a safe and open economy. So that's it, and I think we're ready for a vote. Unless there's anything else from council.
If I may.
Sure.
I don't know if the chief is still back there or not, but if he is, I would like to ask him to speak to us. One of the concerns that he has indicated is the overwhelming number of calls for not wearing a mask, taking our police officers away from their duties to answer what most people would consider a minor complaint. If we're overwhelmed with that and our officers cannot perform their jobs, then we're putting ourselves in danger. I would be in favor of supporting voluntary use of masks, but I'm concerned if we pass an ordinance and say, if you're not wearing a mask, then police are going to come, you're going to get a talking to, an education to begin with, the second time a little stronger education perhaps, and the third time a summons. Each time we do that, that officer is being taken away for a period of time from performing other duties that may be more important. Maybe, again, it comes down to weighing life and physical injury versus responding to a minor complaint. And as I say, I'd like to hear from the chief and his viewpoint.
Mr. Mayor, actually, I'd like to answer that if I could as a city manager. I think there's an assumption that the police department would enforce this. That's not currently in my plan. I do not see our armed men and women in blue showing up at, I'll pick on Colt Grill for a minute, showing up at Colt Grill and everybody put on your mask. That's not how it's going to happen. There are other ways that we can enforce this, probably through code enforcement. If you remember during the first stay-at-home order, we received calls. We handled most of those complaints through education and most of them through code enforcement through our community development department. So I actually spoke briefly with the chief because my job is to administer whatever you approve today, if you do or you don't. And we'll find a way to administer it that does not affect our police department. Again, that is not our go-to place for something like this. Education can be done by any city employee if need be. We can look at that. One of the thoughts I had was our part-timers come back to work next week. We can man a phone line and have a hotline so that it doesn't even have to go through dispatch or what happened last time. It either went through Sandra's desk through city admin or it went to community development or 911. We can set up another phone line for our part-timers that we can do. So there is no plan to use armed officers to try to enforce something like this.
Thank you.
So if we're not using armed officers, we would send out a part-time staff. I'm just not clear, and it sounds pretty much like we're discussing passing a mandate that we're not going to enforce, and I'm just not clear on what happens next if this were passed.
Mr. Mayor, Councilmember Henry, yeah, we have code enforcement officers who work full-time, regular employees who are used to educating people and going through the ordinances passed by council. So that would be my first option there. The last time at the stay-at-home order, I think I called for help from PD once or twice, no, probably 2 or 3 times. It'll be very minimal if that. Again, our code enforcement officers, our full-time employees that have been with the city a long time would help address this.
And our code enforcement officers are uniformed officers, correct?
I don't believe so. I don't think Al wears, they do wear blue.
I do believe I read something where the gentleman who supervises these code enforcement officers was not in favor of this.
He's not in favor of the phone calls, which is why I would come up with a solution for the phone calls. He's not in favor of enforcing whatever. One of the things that, and I passed on you the chief's message, and I passed on to you Scott's message to be a non-filter. But one of our jobs as administrators and city employees is to figure out how to implement whatever council says. And we will do that. We'll rise to the occasion. And I think we can do so without creating any jeopardy or safety to our other citizens or the high priority calls that they all work on a regular basis. So instead of a radar gun, there's not going to be a COVID gun or a mask gun, sitting there waiting to catch people to pull them over. There's no plan to intimidate or to be aggressive in any manner. This will be as light-handed as a city can be, hoping for voluntary compliance and that people will respect the rights of everyone and be able to go from there. But Again, whatever council decides to do, we'll implement either way. As you know, the governor did implement CDC compliance for businesses. So any business that's open is mandated to provide space for 6 feet separation. If they can't do that, they have to create barriers. So you'll start to see some changes even around City Hall and otherwise. All our employees are now to start wearing masks when they can't keep 6 feet away. You will see things throughout the organization for us to become compliant with the governor's order, so which is separate from what we're discussing here today. But the city will do as directed as the policy approved by council.
Any other questions from council? No. Okay. All right, then I'll go ahead and move to adopt the proposed emergency policy and order requiring the wearing of facial coverings in close public settings with exceptions.
Second.
Okay, Mayor made the motion. Councilmember Wilden seconded it. If we could have a roll call vote.
Councilmember Henry?
No.
Councilmember Halls?
No.
Councilmember Howdicke? Councilmember Nairn?
No.
Councilmember Wilden?
Yes.
Vice Mayor Matthews?
No.
Mayor Alinsky?
Yes. All right, so that fails. And council, I appreciate your input very much. The public, I appreciate your input on this matter. Everyone that contributed to gathering information and getting that to the council. There were two ways to handle this. One was by legislative action. The other was by proclamation. So I'll be moving forward with the proclamation. Thank you.
So what does that mean?
It meant we just wasted our time.
Yes,
It
that's
meant
exactly
that
what that
the
means.
democratic process essentially was circumvented.
So why did we vote?
Exactly.
I mean, I think if that's the way it's going to stand in protest, I'm not going to participate in anything regarding this body until this is removed.
Agreed.
I'm sorry, I couldn't hear you.
Agreed.
I couldn't hear you. Can you repeat that?
I said in protest, I'm not going to participate in this body until this proclamation is removed. I feel very strongly about it. This is an overreach of government authority.
I agree as well.
I really feel-
Many mayors across the state are doing this by proclamation.
Not after a democratic vote. This is not the appropriate procedure.
I do feel, Mr. Mayor, that if you were going to make a proclamation, you should have just done that and not asked the council for their opinion.
As I stated, your opinion is important to me, and gathering public information, public comment from the public is important to me as well. But
It's important to me,
I
too.
feel there's a drastic, there's a severity here that I cannot ignore, and it is within my authority to do so. And I am relying on the experts to give me the information, and I am doing what I believe is right to protect the vulnerable in our community.
Move to adjourn?
Second.
Okay, Councilmember Nairn made the motion. Councilmember Henry seconded it. All in favor?
Aye.
We're adjourned. Thank you.